The Inheritance of Traits, From Genetics to Heredity. Edited by Kasaf Noreen. Written by Natalie Wong, Michael Tang, Hanna Redda, Natalia Raza, Harim Bilal, Vivek Kanan, Natalie Jean-Marie, Mikhail Haptemikal, Mackenzie Schuler, Maya Elizabeth George, and Navneet Kang. Narrated by Marcile Wilmot. Chapter 9. How Does Genetics Impact Us? Written by Mackenzie Schuler. How do genetics impact health? Genetics have been linked to health problems in many situations. Whenever someone goes to the doctor asks for a family medical history. This is so they can determine if that person may have a predisposition for mental, physical, or emotional diseases. Predisposition is defined as the likely risk of experiencing or suffering from a particular disease. If someone has a predisposition to a certain disease, this does not mean they will certainly have or experience the symptoms of the illness. It just means that there may be an associated risk. Some of the questions doctors ask about family medical history are relatively simple: ethnicity, mental health conditions, pregnancy complications. However, some of the questions are hard to answer as they may require information about deceased family members. Due to this, some people prefer to prepare a concise medical history prior to a doctor's visit. It is important to provide doctors with medical records so that they have all the appropriate information to help and support their patients. Biologically, every individual inherits half of their genetic profile from each of their parents. Certain genes inherited can represent possible concerns for future medical conditions, but certain genes may also represent a lack of concern for medical conditions. An example of this are the BRCA genes. The BRCA genes are also known as the breast cancer gene. Each person has both the BRCA1 and the BRCA2 genes, but not every person experiences the same representation of the gene. Although these genes themselves do not cause cancer, there is evidence suggesting that they may actually prevent breast cancer and tumor growth on the breast tissue by repairing DNA tears that can be associated with cancer or tumors. BRCA genes are known as tumor-suppressing genes due to this evidence. However, in some cases, there are BRCA mutations that do just the opposite. They don't suppress the tumors, therefore, the BRCA gene isn't working properly. A very small portion of the population, 1 in 400, carry a mutated form of the BRCA1 or the BRCA2 gene. The mutated form, as mentioned earlier, may be ineffective when it comes to preventing breast cancer. A considerably large portion of women will experience breast cancer in their lifetime, 1 in 8. The BRCA gene has been associated with an increased risk of developing breast cancer and has been associated with experiencing a cancer recurrence. A cancer recurrence is a second cancer that has returned and can present as the same original form of cancer or as a secondary form. Breast cancer itself is a very treatable form of cancer if it is treated in its very early stages. Stage 1 breast cancer has a 5-year relative survival rate of 100%. However, approximately 10% of women with breast cancer have a BRCA mutation, suggesting that there is a link, but it may not be a significant link. There are 3 common types and 3 rare types of sickle cell disease. The 3 most common types are HBSS sickle cell anemia, which is the most severe form of the disease, HBSC, which involves the odd hemoglobin C, and HBS beta thalassemia, which is a different type of anemia compared to HBSS. The 3 most rare types are HBSD, HBSE, and HBSO. People with sickle cell disease have a considerably short life expectancy, as half are expected to live a little bit beyond 50 years of age. There are treatments available, with the most commonly used treatments being antibiotics for infections and blood transfusions. However, the only cure for sickle cell disease is bone marrow transplants. There are limitations to this cure. There is about a 25% to 30% chance of finding a compatible bone marrow donor, regardless of how many siblings the patient may have. Although some of the associations between genetics and health are related to specific diseases, there is now
Sample complete. Ready to continue?